Recently, in a New York Times article regarding some of the changes that national health reform will bring and its potential impact on the healthcare community, a couple of things in particular jumped out that we think is of value to providers. Number one, the move to push for more graduates of medical schools to go into primary care. Historically, primary care physicians have been compensated poorly in comparison to their specialist counterparts. However, that has been largely driven by how they've been reimbursed. That is about to change. We think the change is going to be important to the healthcare community for a number of reasons. As more and more physicians go into primary care, that classification of risk is much lower than subsurgery specialties or any other subacute specialty. As a result, insurance underwriters are going to see decreased premiums, and there'll be more pressure on their bottom line. Their combined ratios will likely increase, which will make, in the near term, lower premium dollars, but potentially in the long term, a higher loss ratio, which is going to then bring back a harder market potentially for the healthcare community as a whole, since the vast majority of premiums right now are driven by individual providers. In that same funding out of the health reform, the push not only for these primary care physicians, or excuse me, for medical schools to graduate and push students into primary care, the move to electronic medical records is going to continue to put pressure on these primary care physicians because they're not in very sophisticated offices in many times. It is a nursing staff, an administrative staff, and the docs. Oftentimes that creates gaps in their data security, and with the allocation of funds to create electronic medical records, if they're not protected or kept properly and carefully, you're going to find that the increased exposure to privacy, data security, and all the HIPAA rules are going to become bigger challenges for providers and driving up those insurance costs as more and more claims come about.